Thank you so much. Thank you for coming. You know, Get Healthy with Dr. Cooper is a program designed to educate and empower. There's so many patients nowadays with all the information online. They go to Dr. Google and they come asking for a prescription. But today in our show, we have doctors that are going to be talking about women's health and children's health. So listen, don't be hesitant to ask your question because we have a lot of doctors with a lot of information. So welcome again to Get Healthy with Dr. Cooper. My name is Dr. Cooper Dagre, board certified in internal medicine. Welcome.
Welcome to Get Healthy with Dr. Cooper. Discover the secrets to amazing health and longevity. Learn how lifestyle medicine, the vaccine for chronic diseases, can profoundly influence mind and body. Learn simple solutions such as healthy nutrition, exercise, strong family bonding, stress management, and spiritual renewal will empower you to live a longer, healthier, and more abundant life. And now, here's Dr. Donna Cooper.
All right, and we are back. Guys, I have a house full of doctors here today with lots of information on women's health, on general health, on pediatrics health. If you have questions, don't hesitate to ask, all right? So, doctors, I want to welcome you here to Get Healthy with Dr. Cooper. Hertha, you've been on the show before, right?
Yes, I have. Last year, this month.
And we had a blast talking about breast cancer.
Exactly. So yes, it was great.
All right. Now, we have doctors from all over the world right here in this place. We have Dr. Boss. I love your name. I can't pronounce it, though.
Thank you.
And you're, all right, you're from Africa.
I'm from Nigeria.
And Dr. Brown is from my home country, Jamaica. And then do we have anyone from the United States here?
Yes, I'm Giselle Matthews. I'm from Kansas City, Missouri.
Well, welcome again. Let's give them a big welcome, guys. All right, very good, very good. So ladies, I did this intentional, just all female doctors, because we wanted to focus on women's health and some pediatrics. But before we continue, Giselle, I'd like you to tell us a little about yourself, and then we're going to follow with Dr. Boss.
Okay, I'm a practicing obstetrician gynecologist. I've been in practice for over 20 years here in the Valley.
The Valley, what valley you're talking about?
The Rio Grande Valley in South Texas.
That's right.
And I enjoy all kinds of different practicing, but my favorite thing to do is actually education. So I wanted to extend my thanks to Dr. Cooper for inviting us here to contribute our expertise and help people to learn things to keep themselves healthy and their families healthy.
Thank you, Giselle. All right, Dr. Boss, tell us a little bit about yourself.
Hi, I'm Bossa Degulano. I'm a pediatrician. I like to say that my name is like both. The both speakers, unfortunately, they aren't mine. It's not my company.
The
it's a
both.
very sad,
Come on.
very sad thing. Speakers are mine, but my name is spelled that way. I'm a practicing pediatrician, like I mentioned, and I've been here in deep South Texas for the past 15 years.
Welcome. All right, Hertha.
Hi, I'm Hertha Daly, and I'm a practicing obstetrician gynecologist here in the South Texas Valley also. I've been here for about 18 years. Prior to that, I practiced in Boston for about 10 years prior to moving here. It's wonderful being on the show again. Thank you for inviting me.
Welcome again. All right, Marlene.
Well, this is my first time on the show. My name is Marlene Chen Brown. I'm a practicing internist in the Rio Grande Valley, close to the border, as they say, almost south of the border here. I enjoy the people. I love the culture here. I am pleased to be here this evening with you.
Thank you, ladies. And you know, sometimes they'll say, call me Dr. Brown, because also an internal medicine doctor practicing for close to 27 years. So I want to welcome you ladies to Get Healthy with Dr. Cooper. You know, the idea of the show is to educate and empower. A lot of patients don't realize that changing lifestyle is what makes a difference in their health care. So we're going to empower ladies today, all of you sitting there, with information that you're going to use to get yourself and your family healthy. So where do we begin? Who wants to begin? All right. Giselle, you seem as though you're ready.
October is Breast Cancer Awareness Month, and breast cancer is the #1 cause of cancer in females in North America. In the United States, 1 in 8 women, if they achieve the age of 90, will develop breast cancer. The recent advances in early detection and treatment of breast cancer has allowed us to improve the 5-year survival rate of breast cancer from 75% to 90% in the last 50 years.
Very good, Giselle. I always tell my patients that prevention is the best thing, but early detection is the next best. Am I right?
Yes, absolutely.
How can we detect breast cancer early?
The hallmarks of early detection are the clinical breast exam and mammography. It's pretty well agreed upon that the screening breast mammography should begin no later than the age of 50. Between age 40 and 49, the best practice is to enter into a discussion with your physician about when to start mammography between age 40 and 49. But after age 50, it's well established that you should be in a screening program. Now the screening time is...
Giselle, I think that's a little bit confusing because in my practice, I don't know about the other doctors, I start screening my patients at about age 40. What about you, Dr. Brown? What time do you start screening?
I now practice senior focused medicine. That's patients 65 and above, so I don't have too much to do with the 40 to 50
But
year
in
olds.
the past you did. Do you want to skip the question, doctor?
Not really. Yes, in the past I did, but because there's a little bit of controversy. Definitely from age 50, screening should begin. For patients 40 to 50, there's a recommendation that they may be screened every 2 to 3 years, but this requires a discussion with the primary care provider.
Thank you so much. Thank you. And Giselle, are there risk factors?
For breast cancer, yes, there's a number of risk factors. Smoking, alcohol use, and obesity, chest x-rays, excessive chest x-rays. So there are the list of risk factors for breast cancer is quite long. The list to reduce your risk of breast cancer is as far as studies that actually show a reduction is a little bit shorter. Breastfeeding, and the longer the length of time that you breastfeed, the more benefit you get as far as reducing your risk of breast cancer. Also, early child bearing is also a risk for reducing your risk for breast cancer. And third, and probably most important, is exercise. The studies show that between 4 and 7 hours of strenuous exercise a week will reduce your risk of breast cancer from 20 to 80%. So that's quite a large amount.
I enjoyed just what you just said. You know why? Because all of those risk factors are modifiable.
Yes.
So then
exactly.
should I then believe that I can prevent breast cancer with my lifestyle? Ladies, what do you think? Come on.
Definitely. I mean, diet, exercise definitely plays a role. And lately, there have been some studies about alcohol, and even having one drink may increase your risk.
That's true.
So these are things that are definitely modifiable. Weight loss, following a well-balanced diet with lots of fruits and vegetables has been shown to improve or decrease some of these risks.
Sounds good.
Yeah.
I'm going to jump over from breast cancer. I was in New York last week giving a conference, and someone asked me about papilloma virus. Okay. What can we say to that? Who wants to speak to that topic?
I would like to start
Okay.
talking about prevention.
Okay, go ahead.
We are here talking about prevention.
Yeah.
So being a pediatrician, we do see the young ladies and young men as well. And so the recommendations are for the vaccine. There is a vaccine called the HPV vaccine, and it's recommended to be given from the age of 9. As pediatricians, we do give more vaccines at 11, a set of vaccines at 11. So most of the time at 11, we would give that vaccine. Right now, it's 2 doses. One whenever we see the patient at 11, and another dose 6 months later. And the new vaccine that we have has 9 different strains of the virus. And so it has been shown to prevent genital warts, which also leads to cervical cancer, vaginal cancer, vulvar cancer, penile cancer, and some oropharyngeal cancers as well. So
What about the safety? That was a question. How safe is it? You said you can begin at age 9. Those
Yes,
kids
ma'am.
are tiny. They're very small.
yes, ma'am.
So are there risks? Dr. Daly? Yeah,
Well,
sure.
in terms of risk, there's not been shown really any significant risk factors associated with these vaccines. I mean, besides local erythema or swelling or irritation, there's not been any long-lasting effects or side effects or adverse effects related to the vaccines. And that's the 3 vaccines, the bivalent, the quadrivalent, or now the 9, the Gardasil 9. Let me just say another thing. HPV, for those who don't know, stands for human papilloma virus. It's a virus that's sexually transmitted and is the cause of cervical cancer. So in terms of cervical cancer screening, or screening, cervical cancer screening is the model for cancer prevention, because you can identify abnormal cells, you can identify HPV, the causative agent, and in most places where you employ or you begin a program of cervical cancer screening, there has been a decrease in the incidence of cervical cancer. So this is something that's modifiable through population trends.
That's right.
Yeah, so-
Hertha, what about, at what age would you recommend the screening for cervical cancer?
The screening for cervical cancer, there have been different changes over the years, and it has progressed. There's been a task force that was kind of put in place in 2014. The ACOG, which is the OBGYN Association, had previously recommended and have studies that show that annual testing has been proven to work, but then the American Society of Physicians recommended that we don't need annual screening. So at this point, 21 years and below do not require screening. It doesn't matter how long they've been sexually active, because cervical cancer has a very long latency between infection with HPV and development of cancer. So they don't recommend screening at below 21. Between 21 and 30 and 29, the screening is every 3 years, just with cytology. Above 30, with just the PAP, above 30, they recommend screening between above 30 to, or say 30 to about 40, what is it, 45 or 65?
Giselle, do you remember what that is?
It's
65,
30 to
actually. You
30 to 65.
65, that's
every
good.
year. 30 to 65
Yes.
is every 5 years with cytology, or with cytology co-testing, which is cytology and HPV testing, or every 3 years with just cytology. And above 65, the tendency now is to recommend no screening, especially if these people have had all negative PAPs. If there's been any history of cancer, CIN2 to CIN3, then you continue screening them for up to 20 years after treatment.
What is
So-
CIN?
Cervical Intraepithelial Neoplasia.
Right, so
which
if the previous PAP is abnormal or suspicious, then at that time it's going to be yearly for 20
Yeah, it
years.
depends if it's CIN2 or 3. If it's CIN1, then you can, those tend to regress.
Okay.
So you can screen those according to the established guidelines, the new
Very good.
guidelines. But if they've had CIN2 or 3,
or above, then you continue screening for 20 years, even if it's past 65.
Very good. So ladies, if you are 21 and above, then you need to see your doctor. So you can get a pap smear. All right, ladies, I know you have been talking a lot. We're going to take a short break, and we will be right back with more on women's health.
Now it's our turn to take care of those who saw and helped us grow. Their time is valuable. It is time to think of a professional staff who will help take care of them. We at PalliMed Hospice and Palliative Care are the right choice. Our staff and 24/7 services are trusted and reliable. Call us. We are the solution you and your family need. We understand you. We are PalliMed Hospice and Palliative Care.
Thank you guys for being here. Have you been learning a lot?
Yes.
Fantastic. We have a house full of doctors today, and I'm so happy they're here. But Roxy, recently you asked me about the studies to screen for breast cancer. Why don't you ask the doctors?
Hi, doctors. Right now, you guys were mentioning about screening for people that were below 50, that it's not safe. So my question is, thermal screening, would that be a safer way to screen for breast cancer?
Bravo. Good question.
Good question. Thermography is the use of infrared technology to highlight an area that has a little more heat that may suggest an area of breast cancer. However, thermography is not the standard because it has a higher risk of overreading and underreading. So thermography was actually the first modality for screening for breast cancer. But once mammography came around with sonography, it was far and away better as far as a screening tool, and it displaced thermography. You can have thermography. There are places that will do it, and there are some here in the Valley. However, they're usually not covered by insurance, and it's not considered the standard for screening for breast cancer.
Giselle, there's some patients that are afraid or hesitant to get the mammogram done because of the pain and the compression. Would you then recommend thermography?
No, I wouldn't recommend thermography for the reasons before, and there is a theoretical risk because of the radiation with mammography. However, the studies are very clear on it being far and away better than anything that we have for screening for breast cancer.
Still the gold standard.
Still the gold standard.
You got that, Roxy? Bravo, bravo. All right. Does anyone have a question on diabetes or obesity? Anyone want to ask a question? Chef?
Yeah.
Go ahead and ask a question on.
As you all know, every time I'm here, I'm talking about health and obesity. Why do you think so many people tend to go for that junk food and that here in the Rio Grande Valley, we're #1 in the nation. Is there any tips that you could give our viewers on how to reduce the obesity and hypertension or any sicknesses they come because of being overweight?
Good question. Thank you, Chef.
That's a great question. Overweight definitely plays into many of the different chronic illnesses that we see here in the Rio Grande Valley. Obesity, which is diagnosed as over 30%, body mass index, that's comparing the patient's weight with their height, is one of the main problems in the Rio Grande Valley. As you said, this is the fattest city in the United States.
That is so sad.
And because of that, we see a lot of lifestyle diseases. We see a lot of hypertension, which excessive weight brings on. We see a lot of diabetes, and we see multiple cancers, which are brought on by obesity. You asked, though, if we could give any tips as to how people could reduce the incidence of obesity. Well, how do we gain weight? We have to take in the calories, and if we don't burn the calories up, then they're going to stay and become fat. So number one is trying to reduce the intake of those foods that are more likely to cause a buildup in weight. Number 2, to do more exercise. Maybe one of you ladies could comment on foods.
Well, I think here it's also very cultural because people adhere to a specific diet, and it's a diabetogenic diet. You have a lot of carbs, you know, the rice, the beans, and what they the tortillas. And combining the rice with the potato, with the beans, with the bread. You know, it's just, I think it's difficult to change those things. So there has to be some massive education program. And I think it probably starts best with children. It probably is a good idea to start off in the schools, have cooking classes, have just health consciousness and health awareness classes as to what's best for the diet, what alternatives you can use to, what alternatives you can use to kind of mimic the same taste, but a healthier choice. There are apps like MyFitnessPal, and there are other apps on the phone that can be used to kind of help people to keep track of their their intake, and exercise recommendations, etc. So I think all these things will benefit.
Could I
Yeah, go right ahead, Dr.
I
Boss.
just wanted to say something. We are trying to begin young, because it is very sad that we are seeing obesity in little kids, and in our practice we have quite a number of kids that have undergone bypass surgery.
It's amazing.
Yeah,
Amazing.
so that is just a sad fact. And so, like Heather says, there's something cultural. And so I am constantly having to printing out charts for the parents to take home and go show grandma, because they say, oh, at home we try to eat healthy, but it's when she goes to see grandma. Grandma gives everything. Grandma gives the sodas and stuff. And so we are constantly doing that. But as well, for the kids, we have to keep it simple. And so I have in my office a picture of a plate. I say half of your plate should be vegetables, a little bit of fruit, and then 1/4 of your plate should be your carbohydrates, and 1/4 of your plate should be your protein. And then you drink lots of water, about 8 glasses of water a day, and exercise. For kids, the recommendations for exercise are 1 hour, 7 days a week. You don't get a rest. You need to do something, get active, move every day.
You know what, Dr. Boss? What I find is that the parents sometimes don't model health. So at home, all that the kid can find, these are processed food that are high in fats. As a matter of fact, nowadays we are consuming, the average American consumes 87 pounds of fat a year. And that is a sad statistics. So these are some of the reasons why we're having obesity, diabetes, and heart disease in children. And you did mention that you have children who have had heart bypass, open heart surgery as a result.
Sorry, no, I mean gastric.
Gastric bypass.
Gastric bypass.
Okay, gastric bypass
Gastric
in order for
bypass.
them to lose weight.
Yes.
Because the trick is losing the weight. Dr.
Yeah,
Daly?
another thing is that some people think exercise is video games.
Yes, yeah.
So there's a lot of time spent doing video games, but the fingers, that's not adding up to the calories. So I'm not sure if you can say something about
Yes, I can say something about the screen time. So yes, that is unfortunately something new with us, because we didn't grow up with all these computers and all these tablets and all these phones. And so now the statistics show that from age 13 up to age 18, the average teenager spends 9 hours glued to a screen. And from age 8 to age 12, then it's 6 hours. And so we do have recommendations. The American Academy of Pediatricians has recommendations for screen time. Below the age of 18 months, it's recommended that there should be no screen time at all except video chatting. So maybe grandma is somewhere else and you want to video chat with grandma, that is fine. But otherwise, there should be no screen time under the age of 18 months. Between the age of 18 and 24 months, there has been some people who don't want their children to be left behind, or they can learn some stuff from the screens. And so it is recommended that if you wanted to, you could start to introduce them to the screens. But it's not really recommended. But if you are gone home and you want to do something, then find very good educational, 18 to 24 months, educational screens like Sesame Street, things that would definitely teach them stuff. And then from the age of 2 to the age of 5, then it's only recommended 1 hour, and as well, just things that you are sure are educational. And as well, it's recommended that between those ages, anybody that is young, and even the older kids that are not yet teenagers, you should sit down and consume media with them. Explain to them what they're seeing.
Very relevant. Very
Have
relevant.
a discussion
Yes.
about what is going on. Respect the ratings. And there is, the American Academy of Pediatricians has a very nice tool. If you Google family media plan at healthychildren.org, there is something there that allows you and your family to make a media plan. And it enables you to say, oh, there should be some areas where there will be no media, like in the car, like a dinner table, like an hour before bed. There will be no media while you're doing your homework, because a lot of the kids, they found out, are doing their homework and consuming media, and they think it doesn't affect them adversely, but the studies have shown that it does affect them adversely. And then you can agree that, oh, this is the amount of time you're going to be spending. But really, 2 hours.
Thank you, Doc.
Yes.
Thank you so much. You know, it is said that hypertension is the silent killer. But how many of us or you guys stop to get your blood pressure checked? When was the last time you saw a doctor? Anybody want to take that? All right. So, Dr. Brown, why don't you tell us something about hypertension?
You started off so right. It's a silent killer. High blood pressure or hypertension is the force of the blood in the blood vessels against the walls of those blood vessels. And there's a normal range, and there's a range which is abnormal, above which we say that a person has hypertension and needs to be treated. Hypertension is very, very common in the United States. I think it was just 2 years ago, there was 1 person in 3 who had hypertension, but the latest statistics show that 1 in 2 now have hypertension. So it's a big problem that we face in the United States. And it is a diagnosis that is made only if you make the time to have your blood pressure checked. If you have 2 elevated readings 2 weeks apart, that's enough to diagnose you with hypertension. It doesn't have to be constant every single time that you check the blood pressure. So if you go in, we considered, for simplicity, there is more to this, but for simplicity, let's say 140/90 and below is considered more or less normal. And if you have a reading above this, then you should be treated. And what type of treatment? We should always start with lifestyle.
That's right.
I've always heard Dr. Cooper say that let your food be your medicine.
And your medicine be your...
This broadcast was sponsored by Cooper Wellness Center and Faithful Path International Ministries. For more information on how to become a patient or a sponsor, please contact us at 1-844-343-8935 or visit our website www.cooperwellnesscenter.com.